The book is really ultimately about how to be happy and reclaim the joy as a physician, or any other clinician, anyone involved in our healthcare system. So I've learned a lot about myself in this book writing journey. First, that writing a book is much easier and much better if you either have a mentor or have a community to work through it. And I learned about how there is like different types of authors. Some are very organized. They sit down every day and write like an hour. And then there's people who are get inspired, like all of a sudden, like one day they're like, oh my God, there's all these thoughts. They sit down and write a lot. And I realize I'm neither. I'm not like, very good in doing it routinely. The inspiration doesn't come. So I am what is known as a deadline writer. If I have deadlines, like a week before, 2 weeks before, I sit down and I work really hard. So I think the program, the NDP program with my publishing company, I think having deadlines was very helpful to me because it forced me to really crank out and work really hard towards each of those deadlines. And then something else I learned was that there's a lot of kind of negative chatter in my head, and it's not unique to me. I think a lot of authors experience that, but it could really be a really powerful force that could stop you in writing a book, especially if there's a little bit of this tendency for perfectionism, which I think a lot of us have. Then you're like, oh my God, I want the most perfect book. And I've learned that there's no perfect book. And I think Arianna Huffington said, done is better than perfect. And so those are a couple of nuggets about this writing journey. In terms of this book about physician wellness and burnout, I feel like just it's really the impact of burnout is so devastating in our healthcare system. The key message is that we can reclaim the joy in our career, in healthcare. I highlight in my book about how to take care of our body, which involves, exercising, eating healthy, making sure we get enough sleep. Why I wrote this book to help people who are experiencing burnout find a way out, to know that they're not alone. And also by doing that, make sure that everybody in our, every patient receives the best care possible. When you look at all these different solutions, I simplify them to three main areas. Focusing on our mind, our mindset, focusing on our body, and focusing on our spirit. And in the book, I talk about how there are solutions in each of those categories. So for example, focusing on our spirit, it's in that chapter, I talk about what is the main reason we went to medical school or healthcare, to really focus on that and find the main reason, or the way Simon Sinek puts it, the why for pursuing healthcare, and really trying to find a career path that is aligned with our purpose. For me, that those few months of break from my job where I was burned out gave me an opportunity to really focus on my passion for helping patients at the end of life. And also it gave me a break to really know that I was never going to allow or work in a situation where my autonomy, where my agency was going to be taken away from me. So that's what I talk about in terms of focusing on your spirit.